Welcome to NAFDAC and your rails. My name is Tosin Omolaja. This is the program that brings you all the important information you need to know about NAFDAC, the agency saddled with the responsibility of safeguarding our health by ensuring that the foods, drugs, cosmetics, and medical equipment made available to us are safe and wholesome. The mandate of the National Agency for Food and Drug Administration and Control, NAFDAC, to safeguard the health of the Nigerian nation thrusts an enormous responsibility on the agency. One, which requires an enlightened, strengthened, and fully capacitated workforce if the agency must deliver effectively and efficiently. The management of NAFDAC realizes this fact and has always hinged on one key and strategic method, that is, training and retraining of its workforce to build their capacity.
The training of our staff is extremely important to safeguarding the health of the nation. Why is that so? Because if a staff is capacitated in his or her own area, in the directorate, then that staff will understand what he or she is doing and what may be the consequences, positive or negative. If it is negative, then that staff must have been capacitated not to do something that will result in a negative outcome. So training is extremely important. However, for the individual staff, it is extremely important to see yourself in 5 years' time better than what you are today. I believe in maximizing the capacity of the mind. And if a staff is trained, it means that that staff is not just going through the motion. That staff also has self-fulfillment. In terms of leadership, there are few people that were born leaders. Most of us learned how to be leaders, or experience also can teach us on how to be leaders. But it is extremely important in any establishment. For somebody to be a leader, you have to know how to bring people to follow you. And many times it takes emotional intelligence. All of us are differently made, even the same children of the same mother. We are differently made in terms of our emotional display and intellectual capacity and whatnot. And as a leader, you have to be able to know that the people working with you have different tendencies, and for people working with you to know you have different tendencies. That way, you will actually figure out what are the strengths of each of the small group that you have or big group, and you capitalize on the strength and sharpen the weak points. You cannot discard a staff because that staff is weak in this area. No. Look for what that staff can do very well and encourage the staff to do it. But it also is leadership is by example. You cannot be slothering around, not coming to work on time, and think that your followers will come to work on time. So leadership is also by example. So it is extremely important, and that is part of what our staff have been going through, especially as we see one set succeeding the other, to be sure that we don't have gaps when a set of staff retire, things like that.
The premium placed on training by the management of NAFDAC under the leadership of its current Director General, Professor Mojisola Adeyeye, shows the management's understanding that the success or otherwise of the agency depends wholly on the quality of the agency's staff and the capacity they possess. To this end, no cog is worthy to deter the agency from ensuring that its staff get the right training at the appropriate time, as the success of NAFDAC is non-negotiable. Not even the COVID-19 pandemic that put virtually every activity at a standstill in 2020.
Pandemic started, at least hit us in Nigeria, March of 2020. And there were things that we never knew we could do as an agency that we grew up quickly to do. That is what is called the business continuity training, which we went through under quality management system. Meaning you're supposed to do this in 3 months, and now you have to do it in 1 month. Or you're supposed to do it to 1,000 people, now you have 100 people. What do? That doesn't mean you kill yourself, but it's that you reprogram and prioritize. But in terms of training, what we started doing in March 2018 or April 2018 became more understandable to staff, because April 2018 we started using Zoom, because you get more with virtual training plus physical training instead of just physical training alone. You reduce the chance of accidents because people travel and they have accidents. So you reduce risk using virtual training. However, when the pandemic started, we still have to continue the training. In fact, we had to learn so much about COVID-19 disease. We had to learn so much about COVID-19 vaccines that were going to come. So we started using our Zoom. In 2019, I think we had about a little over 1,000 trainings. In 2020, we had over 4,000 trainings because of the ease of becoming part of a training. So we have maximized our Zoom technology to increase the capacity of our staff. That was during 2020, during the 2020 year. However, as things started getting a little bit better, as far as the pandemic is concerned in Nigeria, we resumed physical training, but I ask all the staff, ensure that you maintain non-pharmaceutical techniques to make sure you don't get in touch with, get in close contact with people. I was at the beginning of the year, I wasn't approving any meeting that I know is going to be crowded. If it's going to be small meetings, yes. And now with the year getting better and some of us getting vaccinated, the maintaining of the social distancing is now, of course, it's still being used, but more people can gather in a room, maybe 30 in a big room, or 50, just to follow NCDC guidelines. So because this training is extremely important for our staff, and as good as virtual training is, the physical aspect of it is also very good, emotionally and socially, because you have seen, you interact with each other, you talk with each other compared to just virtual.
We'll take a short break right now. Please don't go away.
The Mech Safety App is the latest reporting tool introduced by the National Agency for Food, Drug Administration and Control in November 2020 as part of the Innovative Medicines Initiative project. The app is made available to the public in collaboration with World Health Organization, Uppsala Monitoring Center, Medicines and Healthcare Products Regulatory Agency, UK, and National Agency for Food, Drugs and Administration and Control, NAFDAC. The Mech Safety App allows users to track safety information of medicines, vaccines and other health products, report adverse drug reaction to a medicine or vaccine, and view data on suspected side effects. When you have received your COVID-19 vaccine, you can use the Mech Safety App to report any adverse reaction or side effect you may feel. The app can be used by anybody, irrespective of whether you are a medical practitioner or not. You, your family, and friends, everyone can download and use the Mech Safety App to report adverse drug reaction. Just search for Mech Safety on Google Play Store for Android and App Store for iOS. When using the app for the first time, the user needs to select his or her region. In this case, Nigeria, and also choose the preferred language of choice. The user will then be taken to the login page where you create an account by providing your email and password, or proceed as a guest. To create an account, you are required to provide the following details: reporter type, example, physician or pharmacist, as well as their name and email address, password with at least 9 characters with 1 uppercase letter and a number. Read the privacy statement and accept. Once you are logged in, the user is presented with a number of tabs, which includes news, products and watch lists. Under the Report tab, the user can report a new suspected adverse drug reaction (ADR). On opening a new report, the user is prompted to input patient details, which include initials, sex, and date of birth. The user is then required to input details of the suspected medicine. These include suspected medicine name, other drug details such as strength, batch, dosage details. Multiple suspect drugs and concomitant drugs can be added at any time. The report can be saved and completed at a later time. A saved report can be found on Pending Reports and can be continued by clicking on the report and continuing from where the user stopped. Enter reaction details, reaction date and outcomes. Multiple suspects' reaction can also be added. Also, further details about the report can also be included, such as did the reaction cause prolonged hospitalization, disability, congenital anomaly, or birth defect, life-threatening results in deaths, and so on. Finally, you can also add details of any relevant medical history before submitting the report. The user receives a message on the app confirming submission and an acknowledgement in the mail for submission. Reports can be created and saved without internet connection and be sent whenever internet connection is available. The product tabs show all medicines in the NAFDAC list database. It's easier to navigate to a drug or vaccine of interest, and this data is obtained from the WHO Uppsala Monitoring Center. User can also add products of interest to their watch list to get the latest information on the drugs. All products added to the watch list can be viewed in the Watch List tab. The News tab displays drug safety information by NAFDAC. This is usually up to date with drug safety information. Registered users can also edit their profile or change app settings. For more information on the app, please contact the National Pharmacovigilance Center (NPC) at NAFDAC headquarters, plot 2032, Olusegun Obasanjo Way, Wuse Zone 7, Abuja, or call 09290511110 or send email to medsafetyapp@nafdac.gov.ng or pharmacovigilance@nafdac.gov.ng.
Welcome back. If you are just joining in, you're watching NAFDAC and your rails. If the training of staff and the quality of training they get matter so much to NAFDAC, a proper training outline and the caliber of people engaged as resource persons also have to be top-notch. This aspect is also given the due attention it requires.
In terms of getting the resource people for our training, again, it is extremely important to know that those who will be training our staff have been trained well themselves. As part of strengthening the regulatory framework, the auditing that we are going through now, the global benchmarking, lay emphasis on training. So even if I don't want to, which is not the case, that's my life as a professor, it is expected of a strong regulatory system to have annual training plan and to demonstrate it when the auditors come, that this is the annual training plan for NAFDAC, that this particular directorate has 10, 15 types of trainings that they have planned for the year, and at this time of the year, they have done 50%. They have done 60%.
If it's not improving performance, then it is not knowledge management. So when we go back and NAFDAC starts to implement its knowledge management, please let us all have in our minds, and at the forefront of our thinking, that it is all about performance improvement. And it is not just about the collective performance improvement, but it's about the performance improvement of what me, just like she said, me, the NAFDAC A, is doing, to this NAFDAC B, because that's the only way the corporate performance can then be read, seen, and measured. And it enables the organization acquire and sharpen and utilize its competitive edge for survival. All these ones that we're saying now, after we'll be able to effectively implement its QMS, it's worse. The QMS is not alone, isn't it? I'm sure that all this QMS thing we're talking about is what you and I are supposed to do, isn't it, ma'am? So by the time we do it, and I know why she has to do it, because, can you imagine Nigeria? And you can imagine the strategic position Nigeria is in Africa and even the whole world, to be honest.
But what I want to talk about is having a sense of purpose.
Thank you.
That it is your choice to navigate the system.
Mm-hmm.
Sometimes we behave, or per time we behave like the system owes us everything. It said, but we actually owe ourselves a duty to drop something into the system. And then we should make sure that whatsoever thing we're dropping in the system should affect somebody positively.
Absolutely.
And then even though we notice that what we're dropping in the system is affecting people in the negative, we should be able to redress our steps and then be able to change. Then you have a sense of purpose. It is your choice to actually navigate the system. And then in navigating the system, you must have a purpose before you go in there. Without a purpose, you can actually make something out of the system. That is what I like.
Thank you very much. Management is a continuous process.
Presently, NAFDAC is moving on to the next level of its quality management system implementation. And knowledge management is obviously very, very important. It's a key component of ensuring that all the systems, the quality management systems put in place, are effectively implemented to get the right results and the expected and desired results. So we have been engaged to take the participants, the NAFDAC workers, all across the levels, the grade levels officers, in the fundamentals of knowledge management. So they will understand, the real meaning of knowledge, the intricacies, and how to effectively manage the knowledge, the wealth of knowledge within them as individuals, and the wealth of knowledge that is already collated and existing within NAFDAC as an organization itself over the years, and harness these two together to effectively share them, across the different divisions and departments to effectively improve productivity and performance, and obviously, the image of NAFDAC.
Prior to now, you just feel that, okay, your own is just to rise to the top, write an exam, and get promoted without knowing what you are being promoted for or what the organization stands for. But with this training now, it makes you to know that even at the top, as a senior staff or maybe a director or an assistant director, you are not just there for you, but you are there for the people. Contribute your quota to ensure that the system works. To ensure that the system works. I think basically that's all about the training, to help you and you expand your horizon when it comes to managing ideas, when it comes to managing the system, when it comes to managing in the organization.
I learned that the whole world is a system, and we all have, whether negative or positive, things to deposit into the system. And also, I also learned that knowledge management is information you receive and it mixed with your thinking and is now deposited into your heart, and now it will now inform an action in you. So it is that action that will now bring your positive aspect, your negative aspect.
What I have learned today is that if I must perform very well, if there must be improved productivity or performance in my job as a NAFDAC officer, I must understand that it is left for me to bring my own quota of what I know and the quota that the other person know, so as to ensure that we move forward with it. That is to say that I've been to this place, I've learned some things, I've learned some new things. What am I expected to do? To share that knowledge with the other people, to cascade it down to other persons, so that they will also understand that, you know, it is important that what you know should be shared with the other person, so that that knowledge is kept and that knowledge is used for the general good of the agency.
The management of NAFDAC has identified the need to domicile knowledge in the agency, and that is what informed this training. Now, this is the second batch of this knowledge management training. The first batch was held in July in both Ibadan and Nasarawa State, and feedback reaching the P&S directorate showed that it was very, very impactful.
I made it mandatory now that our staff, that any staff going through a training must have pre-test and post-test, because monitoring and evaluation demands that you show that the staff actually gained from a particular training that he or she went through. So it is a holistic approach to ensure that our staff are capacitated, and it's not just that, to ensure that the agency is strengthened on the long run.
In view of the commitment of NAFDAC to the consistent training of its staff, it is obvious that the exercise sure needs financing, without which these trainings will hit a deadlock. But this too is in no way a problem.
The resources into it, I mentioned it, we have put that in our budget, in our annual budget, and it is an approved budget that the National Assembly passed. So it is part of, and the source of it, of course, is our user fees. Our user fees are fees that are paid by our clients to get their products approved. Because again, you want a staff that is capacitated to be part and parcel of the registration of a product.
Here is where we draw the curtains on this edition of the program. Join us same time, same station next week for another informative package. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, please call 0800 162 3322 or email nafdac@nafdac.gov.ng. COVID-19 is real. Please ensure you and your family follow safety measures as outlined by the NCDC. Stay away from crowded places as much as possible, and if you must be out there, please wear a face mask. Wash your hands regularly with soap and water, and ensure you use only NAFDAC-approved alcohol-based hand sanitizers. Taking the NAFDAC-approved COVID-19 vaccine is safe. It's our best bet of stamping out the deadly coronavirus. And don't forget to download the Mech Safety App from iOS or Play Store to report any adverse reaction from the vaccine or any other medicine at all. See you next week. Stay safe.